Is it normal to experience ovulation bleeding every month?
In this video, we'll explore whether it's normal to experience ovulation bleeding every month. We'll discuss what ovulation bleeding is, its causes, and when to seek medical advice.
What is ovulation bleeding?
Ovulation bleeding, also known as mid-cycle spotting, is a light vaginal bleeding that occurs around the time of ovulation. It's not as heavy as menstrual bleeding and usually lasts only a few hours to a couple of days.
Is it normal to experience ovulation bleeding every month?
While some women may experience ovulation bleeding occasionally, it's not typical to experience it every month. Ovulation bleeding is considered a normal variation in a woman's menstrual cycle, but it doesn't happen to every woman, and it doesn't happen every cycle.
What causes ovulation bleeding?
There are several possible causes of ovulation bleeding, including 1. Hormonal fluctuations. The drop in estrogen levels during ovulation can sometimes cause the uterine lining to shed, leading to spotting. 2. Follicular rupture. The process of the egg being released from the ovary can cause minor bleeding. 3. Implantation bleeding. This occurs when a fertilized egg attaches itself to the uterine lining, which can cause light spotting.
When should you be concerned?
While ovulation bleeding is generally harmless, there are situations when you should consult your healthcare provider. 1. Heavy bleeding. If the bleeding is heavier than your regular menstrual period or lasts longer than a few days, consult your healthcare provider. 2. Pain or discomfort. If you experience pain or discomfort along with the bleeding, it could be a sign of an underlying issue. 3. Consistently experiencing ovulation bleeding. If you have ovulation bleeding every month, it's a good idea to discuss it with your healthcare provider, as it may indicate hormonal imbalances or other issues. In summary, it's not normal to experience ovulation bleeding every month. If you notice any unusual patterns in your menstrual cycle, such as consistent ovulation bleeding, heavy bleeding, or pain, it's important to consult your healthcare provider for further evaluation and guidance.